Case number 6. A 12-year-old boy with sickle cell disease is brought to the emergency room after suddenly developing difficulty speaking and weakness on the right side of his body. Which complication of sickle cell disease is most likely responsible for these symptoms? A. Deep vein thrombosis. B. Renal infarction. C. Myocardial infarction. D. Stroke. Correct answer D. The sudden onset of speech difficulties and unilateral weakness in a child with sickle cell disease is highly suggestive of a stroke. In sickle cell disease, the sickle-shaped cells can occlude cerebral blood vessels, leading to ischemic stroke. Children with sickle cell disease have a significantly increased risk of stroke compared to the general population, often due to small vessel occlusion in the brain. This risk underscores the importance of regular screening with transcranial Doppler ultrasounds in children with sickle cell disease to assess blood flow velocities in cerebral arteries, as increased velocities can indicate a higher risk of stroke.